Dementia doesn't just hit you out of nowhere. It sneaks up on you with subtle signs that often get brushed aside until it's too late. But if you can spot these 15 early symptoms now, you can take steps to protect your brain. Stick around because sign number 7 might just surprise you. Every year, millions of people find out they have dementia, often without any warning signs. The good news? Research shows that catching these early signs can help slow down or even prevent cognitive decline. In this video, I'll share 15 symptoms that could indicate your brain health is at risk, some of which might catch you off guard. If you're serious about keeping your mind sharp, make sure to subscribe. I've got more brain-boosting tips coming your way. Just a quick note, this video is meant for informational purposes and shouldn't be taken as medical advice. If you or someone you know is experiencing these symptoms, please reach out to a healthcare professional for proper diagnosis and guidance. Let's get started. Memory loss. Memory loss is often the first sign of dementia, but not all forgetfulness is the same. While it's normal to occasionally forget an appointment, dementia-related memory loss is much more severe. People might forget important events like birthdays or struggle to remember the names of loved ones. Everyday tasks can become overwhelming. They might forget how to use familiar appliances or misplace essential items like their wallet or phones. This distressing forgetfulness can really impact daily life. So if you or someone you know is experiencing these lapses, it's important to address them early. Recognizing these signs can lead to interventions that may slow cognitive decline. Difficulty completing familiar tasks. Another subtle warning sign of dementia is the struggle to complete tasks that used to be second nature. Simple activities, like driving to a familiar place, following a recipe, or managing bills, can suddenly feel overwhelming. Someone who once cooked with ease might forget steps in a recipe or misplace ingredients. This difficulty arises because dementia affects the cognitive skills needed for planning and executing tasks. If you notice someone having trouble with routine activities, it could be an early sign of mental decline that needs attention. Problems with communication. Communication challenges are a classic sign of dementia, going beyond just forgetting a word here and there. Individuals may find it hard to follow conversations or lose their train of thought mid-sentence, leaving discussions unfinished and confusing. They might repeat themselves, asking the same questions without realizing it. In more severe cases, they might use vague terms like "that thing" to refer to everyday objects. These communication struggles can be frustrating for both the individual and their loved ones, so it's important to be aware of these signs. Most people think memory loss is the first warning sign, but this symptom can appear years earlier and often gets ignored. Disorientation to time and place. While everyone occasionally forgets the day of the week, frequent confusion about time and place can be a red flag for dementia. Someone might get lost in their own neighborhood or fail to recognize familiar landmarks. They may also have difficulty grasping the date, season, or even the year, staying disoriented despite reminders. If you notice someone struggling to understand time or getting lost in familiar places, it could indicate cognitive issues that need attention. Poor judgment or decision-making in dementia can really mess with decision-making abilities. For example, someone might make unusual financial choices, like giving away large amounts of money or dressing inappropriately for the weather. They may neglect basic hygiene or engage in risky behaviors, like forgetting to turn off the stove. If you or someone you know is making poor judgments or odd decisions, it's important to recognize that these changes can signal cognitive decline. Withdrawal from social activities. People in the early stages of dementia often start pulling away from social interactions and activities they once loved. They might avoid family gatherings or distance themselves from hobbies that used to bring them joy. While this withdrawal can look like depression, it often stems from cognitive challenges that make socializing tough. If someone you know begins to shy away from social activities, it's a potential warning sign that shouldn't be overlooked. Mood swings and personality changes. One of the more surprising early signs of dementia is noticeable mood swings and personality changes. A calm, easygoing person might suddenly become irritable, anxious, or suspicious. Extreme shifts in personality, like becoming withdrawn or showing signs of paranoia, can also happen. These changes are due to shifts in the brain that affect emotional regulation, leading to confusion and frustration for everyone involved. Keep an eye out for sudden mood changes, as they may signal cognitive issues. Trouble with visual and spatial perception dementia can affect how someone perceives visual and spatial information, making it hard to judge distances or recognize faces and objects. This can lead to problems while driving or navigating familiar environments. For instance, someone might misjudge the gap between their car and other vehicles, raising the risk of accidents. Be aware of these symptoms, as they are essential indicators of cognitive decline. Here's the scariest part. Many doctors overlook this early dementia symptom, but if you spot it, you can take action right now. Misplacing things and inability to trace steps. While misplacing items is something we all do occasionally, frequently losing things can signal dementia. A person might put items in strange places, like leaving glasses in the fridge, and struggle to retrace their steps to find them. They may get upset if they can't locate something and might not understand why they can't remember where they left it. This inability to recall where things are is a notable sign of cognitive decline. Difficulty planning or solving problems. As dementia progresses, people may find it hard to plan and solve problems. Tasks that once seemed simple, like making a grocery list or organizing chores, can become overwhelming. They might also struggle to follow directions or tackle problems that previously posed no issue. This cognitive struggle can lead to anxiety and frustration, especially when they realize something isn't right. Difficulty with planning and problem solving is a key indicator of mental issues. Changes in sleep patterns. Shifts in sleep patterns are another common symptom of dementia. Someone might start sleeping a lot during the day, leading to increased drowsiness, or they may have restless nights, waking up confused. Disrupted sleep can significantly affect daily functioning, causing fatigue, irritability, and trouble concentrating. If you notice sudden changes in someone's sleep habits, it's worth considering the possibility of cognitive changes. Decline in personal hygiene and self-care. Dementia can lead to a decline in personal hygiene and self-care routines. A person may forget to shower, brush their teeth, or change clothes, neglecting their appearance altogether. This drop in self-care is a sign that cognitive functions related to self-awareness are deteriorating. If someone you know is unusually neglecting their hygiene or personal appearance, it's a significant warning sign. And here's the most dangerous early warning sign no one talks about. So hit that subscribe button if you don't want to miss more life-saving health tips. Repetition of questions or actions. Repetition is a common symptom in the early stages of dementia. A person might ask the same question repeatedly, even after getting an answer. They might also do the same activities, like watching the same TV show multiple times daily. This behavior reflects memory loss and cognitive decline, indicating that the brain struggles to form new memories or process information. Lack of initiative or interest in previously enjoyed activities. A noticeable loss of interest in activities that once brought joy can be an early sign of dementia. Hobbies like painting, gardening, or sports might no longer excite them. They may also neglect their appearance or the state of their living environment. This apathy extends to social interactions, where they might avoid gatherings or phone calls from friends and family. Such changes can indicate a significant shift in personality and cognitive function. Trouble recognizing familiar faces or places. One of the most alarming signs of dementia is difficulty recognizing familiar people or places. A person might forget the names of close family members or fail to recognize friends or even their own home. This symptom reflects a serious decline in memory and recognition abilities, which are core aspects of cognitive function. As dementia progresses, these signs often become more pronounced, causing distress for both the individual and their loved ones. Dementia is a serious condition, and catching it early can make a big difference in the quality of life for those affected. If you notice any of these 15 warning signs, it's important to seek professional help immediately. While dementia can't always be prevented, early intervention may slow its progression or help manage symptoms more effectively. Now that you know the 15 warning signs of dementia, it's just as important to understand the daily habits that could increase your risk without you even realizing it. Stay tuned for our next video, 5 daily habits that increase dementia risk and how to stop them naturally, coming soon. Don't forget to subscribe and turn on notifications so you never miss an update.